Good morning. Dear audience, let me present you my 3-month progress report. My name is Evelin Juhász, and my PhD studies about the applications of dietary fiber in patients with metabolic disorders. I graduated as a dietitian and then as a nutritionist at the Semmelweis University, and now I'm a first-year PhD student at the Doctoral School of Health Sciences. My supervisor is Réka Hermanné Juhász. My vision is to normalize the metabolic disorders of the patients by using dietary fibers instead of taking any medications. And my mission is to draw the attention of the physicians to the results of the studies regarding the dietary management of polycystic ovary syndrome. Here you can see the 2 projects, what I'm working on now. In the first project, we would like to figure out which type of dietary fiber is the most beneficial in metabolic disorders. And based on the results, we will perform a randomized control trial. My first project title is The Effects of Dietary Fiber Supplementation on Glycemic Control and Lipid Profile in Patients with Type 2 Diabetes. This is a systematic review and a network meta-analysis. A short background about this topic. 6.28% of the world's population has type 2 diabetes, which is a quite high number. And in the first-line treatment, lifestyle management is essential. This management includes the medical nutrition therapy, which is recommended for all the patients who has diabetes as an effective component of the overall treatment plan. And counting carbohydrate intake is necessary for the patients in diabetes, and that's the reason why dietary fiber could be a key strategy for them, because much less amount of it enough to normalize blood glucose and lipid profiles in a short period. And in the guidelines on diabetes, there isn't any word about the dietary fibers. So our aim is to investigate the effects of dietary fiber supplementation on glycemic control and the lipid profile in patients with type 2 diabetes. Our clinical question: does dietary fiber intake decrease the hemoglobin 1C compared to another type of dietary fiber, or no dietary fiber intake? Population is patients with type 2 diabetes, and the intervention and the comparators are the same: soluble, non-soluble dietary fiber, and no fiber intake. And the outcomes are the glycemic factors and the lipid factors. Our hypothesis is soluble dietary fiber intake can significantly normalize glucose and lipid levels in patients with type 2 diabetes. And the clinical implication is to prevent long-term complications in type 2 diabetes. Here you can see the search key, what we used on the 3 databases. And now we are at the phase of data extraction. My second project title is The Effectiveness of Dietary Fiber and Inositol on the Ovarian Function and Metabolic Balance in Women with Polycystic Ovary Syndrome. This is a protocol of a randomized control trial. Let me give you some background about this topic. Polycystic ovary syndrome is one of the most common diseases in women of reproductive age, and it has a lot of clinical manifestations like elevated serum androgen levels, menstrual irregularities, anovulation, and significant number of the patients has insulin-resistant hyperinsulinemia and obesity as well. In the first choice treatment, these patients usually get insulin sensitizers, which has side effects like vomiting, diarrhea, and vitamin B12 deficiency. So regarding to the literature, dietary fiber and inositol could be an alternative treatment for these patients. Our aim is to examine the effects of dietary fiber and inositol in the treatment of PCOS. Our clinical question: can dietary fiber and inositol improve metabolic disorders in patients with PCOS? The population is women with PCOS. The intervention is soluble dietary fiber, and the comparator would be the inositol. And the outcomes, the main outcomes, the ovulation and menstrual cycle regularization, and additional outcomes, the glycemic factors. Our hypothesis is soluble dietary fiber is not inferior than inositol in the treatment of women with PCOS. And the clinical implication is to improve ovarian function. Actually, we started the protocol drafting, and we would include those women who are diagnosed with PCOS and aged between 18 and 45, and the only medication what are they taking is just the metformin. We would exclude those women who are pregnant or using other medications or on a hormonal therapy, or had a previous surgery, and who has a Cushing syndrome. And as I said before, the intervention would be on the arm A, the soluble dietary fiber, and in the arm E, the inositol. But at this point, we don't know yet the way of giving these interventions. And the outcomes, the primary outcomes, the ovulation and the menstrual cycle regularization, and the secondary outcomes, the metabolic parameters and the hormonal parameters as well. But these outcomes are still under discussion because of the feasibility. We are planned submission date are the May and the July of 2022. And as a dietitian, I can't say anything else than Hippocrates did. Let food be thy medicine, and medicine by thy food. Thank you for your attention.
Well done. Beautiful presentation. About the second project, which I couldn't understand from your project, is this a study on a lifestyle intervention, or are you planning to use a product? So when you say soluble fiber instead of inositol, are you giving advice to the patient how to eat more soluble fiber, or are you prescribing soluble fiber?
Thank you for your question. We would like to give them a soluble dietary fiber, which will be in a tablet or in a powder form. We don't know yet, but this fiber will be based on the meta-analysis result.
Okay. What are the outcomes? Can you just remind me the outcomes you have in mind at this stage? Because I understood that the protocol is not set in stone yet, but you have got some
The main outcomes, the ovulation and the menstrual cycle irregularities, the additional outcomes, the glycemic factors and the hormonal parameters.
I'm not a gynecologist, so I'm asking you, and you may not know the answer. Are these hard outcomes, or are these outcomes reported by the patient?
Regarding to the literature, we found these outcomes are the most feasible for this project.
What I'm asking are these outcomes which you measure with some kind of equipment, or are these outcomes which the patient tell you, I have got my menstrual cycle is less, or whatever. Who reports the outcomes? Is it an investigator, an assessor, or the patient? Because in that case, I think it's important to think about blinding, if there are many patient-reported outcomes, or if there are important patient-reported outcomes.
So if I may add something, neither Anna is a gynecologist. She's a nutritionalist and dietitian. So these outcomes, of course, the hormonal parameters are clear parameters that can be measured. Mm-hmm. And the menstrual cycle profiles are also clear, of course, reported by the patient. Yeah. But these parameters are used in most of the studies that are investigating menstrual cycles from any point of view.
So blinding may not be as important as always.
Probably not.
Okay. Well done.
Thank you.
I would have a question as well, if nobody else. Regarding your network meta-analysis, first, congratulations for the presentation, of course. I was just wondering, regarding your network meta-analysis, the authors in the studies are giving fiber supplementation, as I understand, in different forms. But I think you should also consider that, I don't know if all the studies also give nutritional advice or recommendations for the patients, because that can somehow change the intervention. And it is not the same if a patient gets a certain type of supplementation, and in the other study the patient gets the same supplementation but with a nutritional advice as well. So that is quite two different interventions. So I don't know if you already checked the studies regarding this.
Not already, I just started the data extraction, but maybe we should do some subgroups, and maybe it could be a solution for this. Thank you for your advice.
Subgroups are a solution for everything.
Thank you.
So, of course, I mean, that's not very easy to ask questions from the leaders of these presentations, because they were there every week. I mean, I would say that in most of these, so you already discussed this. So I'm a newcomer, so I can ask stupid questions again. So there was another plan of comparing metformin and inositol, saying that metformin is a standard kind of treatment, and now we try if inositol is better with less side effects. Now you use inositol as a control. So is this a standard now or not?
Actually, it's not a standard. No.
Well, so I'm asking that, isn't there a better kind of alternative, which is the standard, or there is no standard at all?
Actually, I think there is no standard which is better now, but that's we are here to find out which is the better for the patients instead of taking any medications, I think.